As we all start to analyze our financial output, one begins to examine the value of their possessions. Recently, I have been hearing numerous people discussing concerns about their healthcare benefit, so I started to research the following three questions. Have the medical benefits in America declined in the last 50 years? It is difficult to make a blanket statement about whether medical benefits in America have declined in the last 50 years, as the healthcare system in the United States is complex and multifaceted. However, there have been some concerns and criticisms that the overall quality and accessibility of healthcare in the U.S. has not kept pace with other developed countries. Factors such as high costs, lack of universal coverage, and disparities in access to care have been cited as issues that contribute to this perception. Additionally, some studies have shown that certain health outcomes, such as infant mortality and life expectancy, are not as favorable in the U.S. compared to other developed countries. How have medical benefits declined in the U.S. in the last 50 years? There are a few ways in which medical benefits in the U.S. are thought to have declined in the last 50 years. Some of the key issues include 1. High costs. The cost of healthcare in the U.S. is among the highest in the world and has been rising rapidly in recent decades. This can make it difficult for many Americans to afford necessary medical care. 2. Lack of universal coverage. The U.S. is the only developed country without universal healthcare coverage, which means that many Americans are uninsured or underinsured and have limited access to healthcare. 3. Disparities in access to care. There are significant disparities in access to healthcare based on factors such as income, race, and geography. This means that some populations have less access to quality medical care than others. 4. Quality of care. Some studies have found that the quality of care in the U.S. is not as high as in other developed countries, with higher rates of medical errors, hospital-acquired infections, and preventable hospital readmissions. 5. Outcomes. The U.S. has higher rates of infant mortality and lower life expectancy than other developed countries, which suggests that the healthcare system is not as effective in promoting good health outcomes. 6. Lack of preventive care. The U.S. healthcare system focuses more on reactive care rather than preventative care, which can be more effective in managing chronic illnesses and promoting overall health. It's important to note that the healthcare system in the U.S. is complex and multifaceted, and there are also many areas where the U.S. healthcare system excels. However, the above-mentioned issues have been identified as areas where the U.S. healthcare system could improve. What can one do to improve their medical benefits in the U.S.? There are a few things that individuals can do to try to improve their medical benefits in the U.S. 1. Get insured. The first step to accessing healthcare in the U.S. is to have insurance. If you are not insured through your employer, you can purchase a private insurance plan on the individual market or through the government-run health insurance marketplace. If you are unable to afford private insurance, you may be eligible for Medicaid, a government-funded insurance program for low-income individuals. 2. Shop around. Insurance plans vary in terms of what they cover and how much they cost. Compare different plans and choose one that best suits your needs and budget. 3. Take advantage of preventive care. Many insurance plans cover preventive care services, such as routine physicals and screenings, at no cost to the patient. Taking advantage of these services can help you catch health problems early when they are more easily treated. 4. Using network providers. Most insurance plans have a network of providers that they contract with to provide care at a lower cost. By using a network providers, you can save money on out-of-pocket costs. 5. Ask for cost estimates. Before receiving medical care, ask your provider for an estimate of the cost of the service. This will help you budget for the expense and make informed decisions about your care. 6. Look into government programs. If you are over 65 years of age, disabled, or have a low income, you may be eligible for government programs such as Medicare or Medicaid. These programs can provide additional benefits and financial assistance. 7. Get involved in healthcare advocacy. Healthcare reform is a complex and ongoing process. Get involved in healthcare advocacy campaigns to make sure that your voice is heard on issues that affect you and your community. It's important to note that healthcare in the U.S. is a complex and multifaceted issue, and there is no single solution that will work for everyone. However, by taking advantage of the options available to you, you can try to improve your access to care and lower your healthcare costs.